I'm John Laesch, and I'm running for United States Congress here in Illinois' 14th District. When asked what my top priority will be, I will say the same thing that I said in the last debate, which is I am going to be co-sponsor number 88, 89 for single-payer health care. But this is what I've outlined, just who I am. I'm going to ask you at the end of this to go out and talk to people that you know and ask them to get out and vote for me and ask them to vote for somebody who's going to change the healthcare system. But I want you to understand how to talk about it so this isn't misrepresented, because a lot of our opponents, both in the insurance company and the Republican Party, will spend their time defining this if we don't properly define it out of the gate. Next, I'm going to talk about why nothing changes, what some of our opponents in this race are already saying about single-payer healthcare, and then what I'm going to do to fix it. If you don't know, I was born and raised in West Africa, and to tell you a little healthcare story, my mother served as the village nurse, and my mother converted one of the rooms to be sort of the infirmary, so people came with cuts, scrapes, and bruises. She helped deliver babies. She taught herself medicine out on the mission field in West Africa, and I don't ever remember anybody coming to the door and say that they needed a Band-Aid or they needed penicillin or something, and my mother asking for an insurance card. We moved to the United States in 1986. I was raised in Newark, Illinois. I served as an intelligence analyst in the Middle East, graduating from Illinois State University in 2002 with a degree in history, political science, and communications. And as Dr. Young pointed out, I am a union carpenter, proud union carpenter. When we talk about the healthcare system, I think it's important to put out front that we have some of the best doctors and nurses, healthcare facilities, and never forget your nurses. I know we've had some physicians speak tonight, but the nurses are really the glue that holds that system together. But unfortunately, we have one of the worst healthcare financing systems in the world that leaves 47 million Americans without healthcare. And to show, those people that say, well, we don't want universal health care and we're not ready to pay for it, I'm going to walk through some things here because I think we already have universal health care. It's called the emergency room. This is a tour that I took during the last campaign through CGH Medical Center. It's out in Whiteside County. And I'm talking to the CEO, the administrator of that organization. And he, I talked to him about single payer and would he would be amenable to it and what sort of things he would like to see as part of the system. And he told me, look, John, almost half of the people who come through CGH come through the emergency room. And it's the most expensive way to provide care to anybody who needs care. So we technically already have universal health care. It's just horribly inefficient. Let's just take the example of David, who has no insurance, and Jack, who has insurance. If Jack has insurance and he gets a cold and he goes to the hospital, it might cost him $120. His insurance is going to pay the bill. And that's the red guy at the bottom. If David has no insurance and he gets sick, he's probably going to put off going to the doctor until it turns into pneumonia. By the time he has to go to the doctor, he's going to have to go through the emergency room because that's the only care that he can afford. And you'll find at the end of the day, there's going to be a very expensive healthcare bill at the end. So somebody still has to pay for the doctors and the nurses that took care of David when he went through the system, when he went through the emergency room. That's what's called uncompensated care. And what hospitals do is hospitals pass uncompensated care onto the insured patient. So the next time that Jack goes through the healthcare system, his bill is not going to be $120, it's going to be $165. And what the insurance company does, of course, is they raise their premiums. So this turns into, one, just to say it, everybody's paying for it. Dr. Young pointed out we're paying 2 times what they're paying in Canada, but they're just not getting the health care. And at the end of the day, it becomes like a balloon because the number of uninsured, as insurance premiums go up, the number of people who can afford that health insurance increases. And that just increases the population who are going to be going through the emergency room, and it's going to increase the cost and the premiums will continue to skyrocket. So the question is, if we have this universal healthcare system that is inexpensive and does not work, why doesn't anybody do anything to fix it? The answer is a place in Washington, D.C. called K Street. This is where all of the lobbyists are. And it's convenient. It's right there between the White House and, of course, the United States Congress. They cut off Pennsylvania Avenue, or else they probably would have bought up Pennsylvania Avenue, but access has been cut off since some of the terrorist events that happened in the Middle East. But if you look on the right, the last big healthcare bill to go through was Medicare Part B. And all the drug makers, HMOs, and insurance companies hired over 952 individual lobbyists to work the floor of the House of Representatives to twist arms. And in fact, the bill was passed between 3 and 6 in the morning, a time when no seniors are awake. And this is a bill that's supposed to help seniors. But this was passed between 3 and 6 in the morning. Lobbyists were working, members of the United States House and Senate on the floor of the House to get this bill passed. So it shows you who has access and what's being done under the cover of darkness on the floor of the United States House of Representatives. Back to campaign finance reform, right? I like to point out, I know he's gone now, but I like to point out that this is how much money Denny Nasser took. You have his top 10 contributors up there, and you can see they come from healthcare professionals, insurance companies, and of course the pharmaceutical industry. Moving on, the insurance companies have spent a lot of money. The last time that Clintons tried to push through a healthcare bill, they ran the Harry and Louise commercials, which scared people away from any comprehensive solution. And when you look at who paid for these companies, or these commercials, of course, those were all the people who were benefiting from the system as it currently exists. And of course, I've found that there's a lot of politicians who will continue to spread this fear-based rhetoric. And I'm just going to point out a couple that are running in this race. Because this issue has already come up. And when asked on the stage, there'll be all 5 of us or 4 of us if Bill doesn't come. And they'll say, what are you going to do about health care? And I say, well, I'm going to back single payer. And of course, Mr. Oberweis will chime in and say that, a one-payer system would not work because it would create long wait times and people are already coming to the United States from Canada because they're tired of waiting. Well, it is true that there is a system and process. The emergency room in Canada works perfectly fine, just like it does here in the United States. But I just want to point out that over 500,000 people leave the United States every single year. In fact, very near to Illinois' 14th district, down in Coal City, Carol Wolski traveled as far as India to get better health care. And it was 1/3 of the cost, and she was living in what she called a resort during her whole recovery period. So she described it as an excellent system. And the fact that somebody has to leave the United States to get affordable, high-quality care should be embarrassing to us as legislators. And then, of course, furthermore, the day that we went up to be part of a healthcare rally, I opened the Chicago Tribune, and there's an article in there that shows that the emergency room patients are waiting 30 minutes or more, and those suffering from a heart attack, and this is a near-death situation, are waiting up to 20 minutes. And when you say that, how does this affect us as a society, doctor? Certainly, I would say that, if your emergency room is clogged up with people that don't have health insurance and they could have received care earlier had there been a good preventative care system, I would suggest that if a very wealthy person who has the best health insurance in the world comes through and they have to wait 20 minutes, that puts that person's life in jeopardy. So everybody's at risk here. It doesn't matter how much money you have or how much your insurance program covers. This is my good buddy Chris Lausen, another Republican running. And of course, Mr. Lausen says that America has the best healthcare system in the world. Well, that's not true, because a recent study came out that was in January of this year, conducted by the London School of Hygiene and Tropical Medical, showed that the United States is ranked number 19. We were ranked 17 2 years ago, and before that, I think we were 12 or 13. So we're going down the ladder, and that's not the right direction that we as Americans want to move. Of course, even in the newspapers, when I was sitting in my editorial board interview in 2006, this woman, Chris Bailey, says to me, she goes, well, I think we should get all of government out. In fact, we should do away with Medicare. This year, she's moved a little bit closer to me by saying, I don't think America is ready for universal health care. Well, I sent her this poll that said, it was taken in December of 2007, showing that 65% said the United States should adopt universal health insurance that covers everyone under programs such as Medicare, that's run by the government and financed by the taxpayers. Well, this is a big issue I have because while even the Beacon News said that, we won the last debate, they said, but John Laesch is going to have to move to the middle. Well, I think 65% of the country is the middle. I think when you stand up for the middle class, we are the middle. So we are already there. We're talking about what people want us to talk about.